I think, okay, I think.
Are you good?
Yes,
Are you
I'm
good,
good.
Penny?
Can you hear me okay? Can you hear me?
Yes, we can hear you perfectly
All right.
fine. And I
Thank
have
you.
Kim and Jeff in the boardroom and Michael Bhutan on the line.
Sean just joined us, Kalisha.
Oh, hi. I'll let you take off your gear. Karen, you on mute. What are you saying?
Yes. Can I have your name, the one that's speaking, so I have it down?
Colicia Hercules.
Spell that, please.
Colicia.
And last name?
Hercules.
Okay. All right, let me just make sure I have everyone. Michelle Allen.
Okay, we're ready to start. Are you okay, Karen? Because
Hold
when
on
I
one
start,
moment. Hold on one minute. I just want to make sure I have everyone. Okay, go ahead.
Okay, thank you. Everyone, can you please keep yourself muted unless you're speaking, and the chair would call on you by name to speak, okay? Thank you.
Thank you, everyone. Thank you for joining us for the meeting. With this, I would like to start the meeting. The first line of business is to approve the meeting minutes. Do I get a motion?
So moved.
Okay. Any seconds?
Second.
Thank you. I would like to go all in favor.
Yes.
Yes.
Anyone opposed? Hearing none, the motion is approved. Thank you. And the first thing that we have is our report from, so we have our report.
Good morning. Thank you. Kim Mendez here. I'd like to just thank you. Start with some introductions with the room. In the room here with me today, I have Jeff Lutz, our Chief Technology Officer, Sean Koenig, who's our Chief Application Officer. On the call, I have Dr. Michael Boughton, who is our CMIO, and I am Dr. Kim Mendez, the CIO for the system. We do not have any resolutions today, so we'll be providing a general update from our EITS, our Enterprise Information Technology Services. Thank you, David, for that. This morning, I thought what we would do is just highlight some of our goals for 2021, and in particular, 3 that we are utilizing for the dashboard, the strategic dashboard metrics. Then provide a general focus on where we have come over the last year, highlighting some of the COVID-19 initiatives that we are worked on over the last 8 to 9 months, as well as what we're working on today, and then touch base on a couple of key areas from continuous quality improvement. Next slide, please. Thank you. So we've shown this slide before. We have 5 key areas that we're working on. You can see highlighted the areas are our data center migration strategy. We'll have a brief update from Jeff on that. Our biomedical device integration, very important for our COVID initiatives and the work that we are doing across the system. Dr. Michael Boughton will speak about that, as well as provide some updates on MyChart utilization. And Dr. Boughton will speak about that. Next slide, please. Thank you. So, Mike, I'm going to turn it over to you for a general overview of where we're at and how we progress throughout the year.
Great. And I wish I could be there in person, but we're actually working clinically in an hour at Harlem. So I'm glad this was able to work and I was able to join remotely. So
Thank you.
MyChart is our patient portal where patients can come in and view their healthcare information. Now, there's a number of reasons. When you're looking at this slide, we far exceeded any of our expectations for the year. And there's a series of reasons for why we so far exceeded. One of which, and I just need to name the elephant in the room, is COVID. Patients were getting their appointments for testing. When we were doing testing for COVID through MyChart, patients were getting, now that they're getting their vaccines, that's one of the main ways they're getting their vaccine appointments is through MyChart. But that's not really the whole story, and that doesn't explain why we've so far outpaced the rest of the country in this area. So the average safety net hospital has 37% of their patients enrolled in MyChart, and that's as of right now. And so we went from below that to far exceeding that. And so while a big group of this improvement is certainly from COVID, a lot more of it is also from us engaging with our patients and trying to make this a very useful tool. And that is, we include our doctor notes. So if a patient comes and sees me in the emergency department today, as soon as I sign the note, the patient is able to go into the chart and read about their visit. Their health information is all there, their lab results. So we really strove to make this a very engaging product. And the engagement, we actually increased the number of times that patients are actually coming in and touching us. So if they're coming in, they used to come in around 5 times a year through MyChart. Now they're coming in around 7. So we have improved that, and that's not explained by COVID. And the other thing I want to attract everyone's attention to is kind of this relatively wide range. You have Harlem down at the bottom at 38%, and you have Cumberland up at the top at 75%. And when I started to look at this, I was wondering why. I presume you also might be wondering why. So these first 3, these are outpatient primary care sites, and all of our numbers across the board are higher for primary care sites. If you don't have an emergency, if you don't have patients that are coming in and for your emergency department, for your other services, just a subspecialist, just once. If it's your primary care, the numbers are generally much higher. So for instance, Harlem, when you look at just their primary care numbers, are about 20 points higher. Similar situation with Woodhull and Jacoby. But then Coney, which is one of our acute care facilities, their numbers stay about the same when you factor in primary care patients, so it's really a much narrower range. But what we have shown to be successful with getting patients to enroll in the MyChart is when you show up to registration, they talk to you about enrolling with MyChart. When you see your provider and your nurse, we talk to you about engaging with MyChart, and that's a way to get a prescription refill without having to come back in. And then when you leave, we actually send you an email or text notification, depending on your preference, to sign up for MyChart. So really, the success here has been threefold: COVID, engagement, where we're making it a useful product, and telling our patients about it across the board. Any questions on this one before I move on to the next slide?
Let me ask, any questions, Jose?
No, thank you. Excellent work.
Okay. Barbara?
I just wanted a clarification. The numbers you read, the 38% against Cumberland, are you saying this is the level of enrollment for those 2 facilities?
Great question. So let me clarify. So all these numbers on the left side of the screen are what percent of the patients that have shown up at these facilities in the past year have an activated MyChart account.
Okay, thanks.
So our overall average across all comers is 55%, made up of the composites, the weighted score on the one on the left.
Thank you.
Yeah. Scott, any questions?
No questions.
Okay, thank you. Yes, Michael, you can continue.
Great. All right, we can go to the next slide. All right, biomedical device integration. I could talk for a while on this, but I'll be relatively brief. What this is, and I think it's best explained by an example. If you have a medical patient on the floor and they're attached to a cardiac monitor or a vital sign machine, what 2 years ago, what we would need to have done is send a nurse or a PCA into the patient's room every hour, 2 hours, 4 hours, depending on the situation, write down their blood pressure, their heart rate, their pulse ox, walk over to Epic, or walk over to our electronic medical record, manually type in the data, and generally when you did this, the nurse or the PCA would do a whole bunch of patients at once, and then they would sit down and they'd transcribe a whole bunch of patients. This introduced the possibility of error, and this also led to significant delays. So what we have done to give our providers and nursing staff the most up-to-date information is we've integrated those machines. So the information now flows from that device, the cardiac monitor vital sign machine, to a central station in the unit that you can monitor the patients on all at once. And then from there, it goes directly into our electronic medical record. Now, the nurse does have to verify it, and we do that as a quality check. But the ease of use saves nursing and PCP time, and it allows everyone else more up-to-date information on which to act on their patients. So this is a big time saver for our whole staff, and it's also providing better quality of care by giving our staff more up-to-date information. You know, I talked about vital signs, but the same thing is through dialysis machines, right? You know, the exact same logic applies. We're taking information that used to be manually collected. We're now electronically collecting it, still having a verification step to assure quality, but this is a huge improvement for our system from a time perspective. And our goal right now, we're at 47% of the devices that are listed here integrated, and by the end of the year, we're going to move to 70%. You know, if you talked to me a year ago, we would have been at like 19%. So we've already made strides in this area, but we want to accelerate that progress.
I have a question.
Any questions? Yeah.
Yes. I'm really excited about this. You're saying that the dialysis machine can integrate clinical values into the record?
Yes. So, for instance, in the dialysis, I don't want to be too technical, but there's the flow rate and there's other, you know, there's other variables that are important. No, blood pressure, heart rate,
yeah.
All those are important also. But with the dialysis machine, the flow rate's important too. So we take that information directly from the dialysis machine. I shouldn't say directly, but it goes from the dialysis machine into Epic.
Yeah, you know, like the critical lab values as well?
So critical lab values are actually on the result when they come back. So are you saying like a critical vital sign result? Like if it's all of a sudden the heart rate goes down? Is that what you're referring to? Or are you actually saying
no, you know, you have certain certain chemistry values before you can start a dialysis. So I was just wondering if that is available and whether it has an alert.
Yeah, no, good question. Slightly, if I'm understanding the question correctly, it's a slightly different workflow. So the dialysis machine itself, I'm not aware of it running its parameters around hemodynamics. As far as lab results, those are going from our lab, and there is an alert process to notify our providers, but it is separate than what I'm talking about here. This is more about like hemodynamics.
Thank you so much. Thank you.
Okay, Jose, do you have any questions?
No, thank you.
Okay, Scott?
No, thank you.
Thank you. Yeah, Michael?
All right.
Okay,
Great. Thanks,
sorry.
guys.
Good to go forward. So our third area that we wanted to highlight was around our data centers. And you might recall in our last presentation to the board, Jeff Lutz presented our resolution for moving forward with the proposal for 2 new data centers. And so we'll provide an update in our next steps following that approval. Jeff?
Thank you, Kim, and good morning. So as Kim had mentioned, this is our initiative to replace our existing data centers with 2 new data centers, and it'll take us over the next couple of years to make that move. And so we wanted to provide some updates. The first area is that we are working to complete the agreements. So our QTS, which is our data center in New Jersey, is going through final signature process, and the Cyrus One agreement, which is the data center that's located in Norwalk, Connecticut, is in the final stages as well with the legal review. I really want to thank the Newmark team as well as the New York City Health and Hospitals legal team for really helping to see this through and keeping us up on timelines there. So no concerns at this point. You know, we look at those getting completed here this month and allowing us to keep pace with where we expect to be. In parallel to that, we have a partner that was selected, Presidio, and as the role as systems integrator. And what their role is to help us to not only understand and make sure that we've validated everything that's at the current data centers, but build the plan to move into both the new data centers as well as our cloud strategy. anything that would move and migrate up to the cloud. So they'll work through a lot more of the project plans, how those moves will happen, a lot of this information that we'll share with you all as we move forward. Equipment that gets retired, if we stand up new equipment, things like that, will all go into these plans so that we can be very meticulous and public with where we're going. So we're working through a lot of the setup with them. Right now, there's a lot of back-end meetings that we're getting set up. We'll have a kickoff meeting here in February with the IT team and some of the other in key areas that people are involved with this, as well as setting up all of our project governance and some of the other more detailed design sessions and meetings that go along with that. Next slide, please.
Can you just tell us just a little bit about the security around the cloud and such? We live in such a perilous time with problems with IT thefts and so forth. So I was just wondering if you could just speak to what kind of securities we have.
Sure, great question. So right now, I'll walk you through a couple of the steps. Remember, and you can go to the next slide too, Dave. It'll help give them. But so these data centers will not come online until they are connected into our internal network. So they will, by default, have all of our current security in place, all of the virus scanning, all of the intrusion detection, all of the layers of security that we have in place will be built, and they will, when they come up, they will be part of that. And even though these are shared data centers, all of our information in all of our servers, everything is physically locked into our own cage. We do not share any of our environment with any of the other tenants that are in the building. They do not have access to any of our areas. We do not have access to theirs. So there's both the computer security, the technical security, as well as the physical and logical security that's there as well. And then for the cloud piece, which is something we'll come back and really help to clarify a lot of. But part of the reason that we entered into agreements with these data centers as well is they actually also do a lot of the hosting. They'll allow us to do a lot better, more secure connections, as well as some higher speed connections directly to a lot of our cloud providers. So also then increasing that security, but then also allowing us to make sure that we have the proper guards in place so that, again, anything that happens in that environment does not adversely affect us in our internal environment.
Thank you so much.
Yeah, so it's a definitely great question and definitely top of mind for us as well. Which leads me right into, this just gives you, again, a timeline so you can understand where we're going with it. Again, right now we're in the area of those foundational activities, again, getting a lot of the setup and everything ready. We anticipate we'll actually start a lot of the work come April, but the main work really to start in QTS coming in the third quarter of this year. And then the Norwalk will be about a quarter or so behind it as we go through that piece. If you want to go to the next slide. This gives a little bit more of the milestones. And again, as we work closer with Presidio, Sean's team, security, everybody that's involved, this will become more and more fleshed out. Right now, these timelines will not change much from what you see on there. And to remind everyone, the real big timeline or milestone that we need to make sure that we keep in mind is our SunGuard agreement runs out in October of 2022. Right now, we are anticipating to be out of SunGuard by August of 2022. So just allowing us time, just in case if we need it, but then we're out well in advance of that agreement finalizing. So with that, any questions?
Yes, I have a question. Here, I think you mentioned that your plan is to be out by August 2022, but SunGuard is October. Is there anything in the contract that by any chance, again, we're not seeing that at this point, we are not able to move out by October, can we do like month per month extension, or what would be the approach to be followed?
No, good question. So we've already, our current contract would end there, but we are in talks with SunGuard. They're aware that we're moving out, and they have said that as we finalize the plan and we get closer, that we could do a month-to-month with them.
Okay.
For that. So, you know, we've been very open with SunGuard about this process. So they're very well aware and are very willing to work with us to make sure that we do have the time that's to move out. You know, ideally by that point anyway, all of the primary systems such as Epic and everything will have been long moved to the new data centers. Those systems that'll remain there will be, you know, non-production environments or things that we would be able to hopefully get very quickly at that point. But there is the opportunity to go to month. We wouldn't have to do a year agreement.
Thank you so much. I just want to see if the other members have any questions. Jose?
No, thank you.
Barbara?
I can't hear.
If you have any question. Barbara, can you hear us?
Yes, breaking up.
Oh, sorry about that.
Are you guys speaking?
Do you have any questions?
Oh, no, I don't. I'm sorry. But you are breaking up. I'm not sure why.
Thank you. Scott, do you have any question?
No questions.
No, thank you. Okay.
So we can go to the next slide. It's actually a continuation. I thought it would be, you know, since we focused on our 2 new data centers and the migration to a QTS and Cyrus-1, Jeff's team has actually been working on a variety of key infrastructure updates. Jeff, if you want to just do a quick highlight of some of the other key areas that we focused on.
Sure. And yes, so quickly, we already talked on the 2 new data centers. The next one, it talks about our VPN. And so we migrated to Cisco AnyConnect and to Duo. What that allows us is it's a better system for us that's easier to integrate into our current environment, as well as allowed us to meet the city directive on multi-factor for any of our remote access. So that's where now when the users come in from VPN, they're prompted for a code on their phone and they can hit press OK. There's other alternatives, but now that's that second factor. It's a much more secure environment for us, but a very easily integrated environment, so it's not too much difficulty for the users to get in. One of the other items that we've done is Metro Plus is now, as part of the moves from to our 50 water location, Metro Plus actually maintains a data center within 160 water. So what we did was, instead of building out something that's very expensive in our 50 water location, we actually moved them to our Jacoby data center. They will be moving with us to QTS and the forward, but right now we took the time to provide them a much better environment in an actual data center area. So they've been very happy with that, and that helps to also again save money on that future move. One of the other areas related to DSRIP and CRFP is the improvement of our contact center. This is the area that takes care of our patient appointments, any of the single number that all of our patients call into now. We moved them from essentially what was the Cisco Lite version for contact center into their enterprise system. So this allows for a lot better features of reporting, tracking the agent's abilities for us to expand that system, as well as it allows us to do Epic integration, which we have recently turned on. So now as they get caller information, it actually will go out. It'll pull up that based on that information that they get the phone number. It'll give them a list of patients they could be calling so that now they can get to that patient information quicker and improve that experience for those patients. The next one as well is our secure print. This ties into our managed print environment, where we are looking to drive down the number of printers that are out in the environment. One of the challenges that we had always, requests from the users was around that where reports would automatically print, or if it's in a shared environment, that when they would go over, they weren't sure which job was whose. There'd just be a big stack of papers that were there. So what this secure print does is it allows them to go up, they can use their tap badge, they tap on their environment onto the printer, and then it'll print out the documents that they want. If there's something they don't want to print, they do not have to print it. So that'll save us there. The other nice thing is that in the event that that printer is busy or not working or unavailable for one reason or another, they can actually go over to another printer and tap right there, and all of their documents are there, again, saving time for them and keeping them working. And we've moved that through all of our acute care facilities, central office, and our Gotham sites as well. And the last one is where we've completed our migration from so our wide area network, one of them was previously hosted through Verizon. We have migrated that over to Light Tower or Crown Castle. And the good news for that is the cost for that stayed flat, but we were actually able to increase bandwidth 10 times. So all of the integrations that Dr. Boughton had talked about, as well as that we'll now be able to handle on the network without any issues, as well as allow us to provide better experiences, open up some of the throttling that we had in place previously for patients and visitors and the like as well, without adversely affecting our clinicians and the ability for them to use our systems. So, any questions?
Yeah, let's pause there for a second.
Any question about the infrastructure?
It's Barbara again. I'm so sorry to dominate today.
No, don't worry.
Okay. It seems to me that, the end users, patient, clinicians, they have a lot of decisions to make with regard to healthcare these days. And it seems like this particular, where we are now, is wonderful that will facilitate that. On the clinician side, the nurse, the dialysis nurse, the nursing telemetry will have more data available to make a good judgment about what is the condition of the patient. And that's so important. On the ambulatory side, there are so many barriers right now to vaccination. It'd be wonderful if we looked at it, who's doing the paper, by the way? If we look at vaccinations and the barriers, everyone's making judgments about it, but they don't have the data before them. So we have a gold mine to figure out how to improve access, I think, for those who still haven't come in for their vaccinations, and I think it's wonderful work. Thank you all so much.
Thank you.
Thank you. Jose, do you have any question?
No comments. I like the whole. I didn't know we had 1,800 print multifunction printers, which is mind-boggling to me.
We learn something every day in these meetings. Jose. Scott, any question?
No questions.
Dr. Katz, I know that you here. I don't know if you have any questions.
No questions. Thank you.
Thank you. Yes, please continue.
Okay, so we'll go to the next slide. Thank you so much. So when we spoke in the fall, we gave a good overview of our first surge, which was from March through June. We have continued to do our business as usual, as well as in the fall we had a significant upgrade in November of Cerner. With Epic, as well as the first phase of Cerner. Sorry about that, Sean, all the work that went into that. In addition, we did bring on board our MyChart bedside, which is an Epic module, as well as our Epic dialysis, which we just spoke about a few minutes ago, Ms. Lowe. We do have a new module for dialysis that interfaces with Epic as well. We are currently working on the behavioral health, and bones, which is the orthopedic module, also went live just this past month. In addition to that, EITS has been focused on many COVID initiatives. We are part of the emergency management, specifically the logistics team, working with Christine Flaherty and the OFD team, HR, et cetera. A major part of our focus has been on our facility surge capacity and space, working with device deployment, and any additional areas there. We are continuing as we did previously in the first surge with onboarding and training of staff for Epic, and this is in the volume of several thousand. Jeff's team, as we move to open our city in June of 2020, Health and Hospitals was front and center with the COVID-19 test and trace, and part of that responsibility was through the IT in setting up the geographical spaces for T2 sites, as well as the Epic and reporting, and the device deployment like laptops and phones. Our most recent work has been around COVID-19 vaccination program. This is at all of our healthcare facilities, the acutes and the FQHCs, as well as transitioning 2 of our T2 sites to be 24-hour vaccination hubs. And most recently, we will be launching this week is City Field as a vaccination hub. And all of our members, if these will be based with our Epic EMR, and so there have been build outs there as well, and also Jeff's team supporting from an infrastructure perspective. In addition, I wanted to bring, if you look at the small graph on the right, you see the little blue triangle, that just gives a visual representation of our telehealth visit expansion. You might recall in March, as we had our first surge, we transitioned our patients from inpatient visits to telehealth visits. And that has actually had an exponential volume in that area, as well as supporting that. We also continue to support telecommuting for several thousand of our individuals who work either part-time in that capacity or full-time, as well as you can imagine with all of the additional volume of, I'll just use the word traffic that's coming in with the testing and the vaccination and all of the different expansion of surge space, we actually have to keep an eye on that, precious infrastructure that we have. So we have been monitoring daily our network capacity, and we have been in a good position there, as well as realigning resources to hit the high priority areas. And up in the right-hand corner, you see the 826. We instituted in March to help give us a real good focus on those priority COVID projects, a new system for putting requests in. It's called ServiceNow. We did report on that previously, but just to highlight that since March, when we put that system in, we had 1,135 total visits. That was as of my printing here. And 826 of those were COVID requests, or we call them demands in the system. So that was a system that we put into place to help us manage that load and help prioritize the COVID needs. And we actually continue to have that in place as we move forward. I'd like to go to the next slide. One of our kind of unsung heroes here is our enterprise support services. And I thought that this was a good opportunity to just kind of show where our enterprise service desk, what kind of volume they have seen from 2018, 2019, and now at 20. If you look at the chart on the left, the green one, and bring your eye all the way to the right bar, they have actually progressed from 50,000 calls per month to 85,500 calls per month. But if you look at the little gold line where it says 1.13, that's the abandon rate. So that means that, 1.13, somebody, just left the call once they called. I did do a follow-up. The average wait time is 41 seconds when you call the enterprise service desk. So and what's important here is and I'm going to talk about it in a minute, is just the capacity and the expansion of the type of services that the support desk supports. Here we're looking at things like, can you turn your computer on? Is the printer working? Or did you forget your password? We'll get a call. We also get emails around those same things. So the graph on the right, which correlates with the graph on the left, is the email volume during the same time of the calls. So I think I want to move to the next slide just to show you the expansion of the work of the enterprise support services. One of the other things, as we had migrated with a lot more improved activation of our patients' MyChart, they also needed support. When I say they, I mean our patients needed support. What if I couldn't get on, that link that someone gave me to get MyChart, right? So actually, our enterprise support desk has taken on that role to support our patients if they are having trouble navigating how to get on MyChart. And you can see, this kind of goes with if you can see the trend that we had in the MyChart activation, you also see that very same type of trend with our support services that they have had. The far right is 22,800 calls from our patients to help them, set up MyChart. So that is a good way for us to utilize our services, but it's an expansion of the role of the enterprise support desk. And the last area that they have actually taken on, I'm sorry, David, could you move to the next slide? Thank you so much. Here, and I'm not going to go through the whole slide, but in addition, when we launched, Jeff, how many is it? Like around 5,000 test and tracers. They're out in the field. They have their computer. Actually, when I go to the Amtrak station, I see them there when people are getting off the train. I'm like, there's the health and hospital staff right there. I have to take their picture. I promised myself I would do that. But they are, out and about in our community. But sometimes their computer doesn't work or their phone isn't working. They do use this two-factor authentication, which Jeff spoke about before, which is Duo. They use the Cisco AnyConnect so that they can get on virtually, but into our network in a secure fashion. And so our enterprise support desk is also additionally supporting all of the COVID test and tracers across New York City through our 2T program. So I want to pause there for any questions. Oh, the last one was, just wanted to do a little follow-up. I think one of the questions that came up is a satisfaction. So I did look at that. And the last time we had oh, you can stay there, David, that's fine. The last time we had a satisfaction survey was in June of 2018. And that was at 94% satisfaction. And we had the system called Remedy at that time. We transitioned, when I say we, EITS, moved to ServiceNow, which is the system that we're using today. That took place over 2019. And Angela Zumarin, who is our lead in this area, she will be doing a survey soon using our new ServiceNow. So we'll be able to bring that back this year. So I just wanted to do a little follow-up on that. Any questions about that before I move into just a couple slides on our continuous quality improvement?
Thank you, Kim. Let me just ask the members if they have any questions. Jose,
Sure.
do you have any questions?
No questions, just great work, and nice to see that we have sort of talked about deploying the system to how we're using it, and it's very exciting to see that.
Thank you, Jose. Barbara?
No more questions. I'm very pleased. Thank you.
Todd?
No questions. Thank you so much. Great.
Thank you. Dr. Katz?
Just to make sure everybody understands that health and hospitals couldn't possibly have a chief information officer or her team that is more flexible, more willing to take on challenges. I mean, remember that when we hired Kim, we didn't even know about T2. We didn't know, how she was going to be stretched to run the vaccine trial, and she and her team, every time the state makes a change, the city makes a change, they act as if they just have to say it, but it's Kim and her team who have to program it. Every change in policy has to be programmed. And her team has just been incredibly good-spirited and willing to take the challenge, work all weekend, work all night. They've really been amazing through this whole thing. Thank you.
Thank you, Dr. Katz. And I just want to kind of add to that commendation, because it's quite impressive, not only the flexibility and the speed at which they implement those changes, but also if we look at the data that has been shown today in terms of the responsiveness to the users, to the different type of users. And I was extremely impressed with 41 seconds average wait time. That is totally unheard of, and 1.13% of abandoned calls. Definitely that shows how much care you have had in terms of ensuring that you're not only building the systems and adjusting the system, but also ensuring that the users are able to do their work and have a good experience. So I just want to commend, as Dr. Katz has done, to your team and you for your leadership in this very testing time, right on the punch with the test and trace. But I think it's incredibly impressive. Thank you so much.
So thank you. I wanted to just, the last couple of slides, highlight some of our continuous quality improvement. This is a new area that we have put on our radar so that we can stay agile, if you will, but flexible at the same time with our diagrams and all of the different dynamic, projects that are going on. You can imagine that, the minute we update one of these ecosystems, 2 or 3 weeks later, it's changed already. So one of the things that we challenged ourselves with, both at the facility level, but as well as looking at the enterprise level, well, you're seeing an enterprise level here, but we have the same diagram for each facility, is that as new projects come in, or we get an upgrade, or we change out an application or a system, we are tracking that change, and we are making updates to the ecosystem, both at the facility level and then up to the roll-up enterprise level. And those are actually posted on our intranet so that they are visible for all to see. You can see all the different types of data center and the connectivity there. And you can also, with those ecosystems, see any of the applications that are actually integrated into our EMR. And we have challenged ourselves to make sure that these are updated on a quarterly basis. And we just completed the December update. The next area, next slide, Dave, please, David, is that, as you can imagine, we have, hundreds and hundreds of different projects that are actually going on concurrently. Some of them, a lot that we hear are the ones that are, are epic oriented, that are more forward facing for our clinicians. But we also have many things that keep the lights running on in the background that you might not be aware of, that need upgrade, or just some maintenance and some just business as usual, or it could be new projects that we are bringing on as well. So to make sure that all of my different service areas are aligned, we have pulled together through our new ServiceNow, which is the application I mentioned, how we're taking requests in. We now have this ongoing timeline of different types of demands or requests, and where are they in the different stages of those projects. What this will do is allow us to say, is there something that we should be looking at as far as the integration, the sequencing of different applications, of when those applications would go live? Is there interdependency on those? And so having all of those in one area will allow each of the teams to see what projects are there for them, but also what projects are in there for their colleagues from the different service line areas, so that they can have conversations about the best way to move forward and sequence those projects, the go live of those projects. So this is just a quick snapshot, and you can just see a quick view of some of the things and the timelines, and how they intersect each other. And the next one, which I think we will all give a round of applause with, where's the drum roll, David? Oh, you're doing a drum roll. Is we have successfully moved off the paper timesheets. And so all of our enterprise is doing web time entry. And even Daryl, decided to get the whole number of how many trees we're saving by not doing those timesheets. So I thought that. But this has been just in all sincerity, this was a lot of work. This work culminated with the go lives after months and months of preparation, as you can imagine, and a lot of end user training. We kicked this off in the fall, and we completed the go live across our enterprise in November of 2020. And then the last area I'd just like to highlight, thank you, David. Oh, goodbye timesheets. Okay, thank you. You're really good. The last slide that I would like to, oh my goodness, who put that in there? It's too funny. The last slide, I would just like to acknowledge that, we have had a nursing information system advisory group across New York City Health and Hospitals. They have these are our nurse informaticists, those who work at the facilities, as well as those who work for here in central office in EITS. We usually had an annual conference that focused on technology and the nursing's role. And this year, Ms. Lowe, I actually decided to put this slide in for us from a nursing perspective, is that Natalia Sinius and I were able to make this the first virtual nursing technology and innovation conference for New York City Health and Hospital. And we kicked that off on December 16th of this year. It was very successful and it was well received. And I will close my report there and open for any additional questions.
Kim, of course, I'm going to say something. This is 10 years later from the time almost when I went to the advisory board looking for improvements in nurse informatics and so forth. And we did what we could, and we did actually better than we could, than some others because we were ahead of the curve with the center at the advisory board. But this is just absolutely wonderful when the nurse at the bedside who's about to start an inpatient dialysis can see all the data she needs to see to check whether the patient is hemodynamically ready for that dialysis is so critical. And perhaps even in telemetry and also OB, where the nurse has got to integrate so many decision points to come up with the final action that has to be done. It's just making our system safer and more appropriate for each patient. So thank you.
Thank you.
So thank you very much. Oh, I'm sorry.
That's okay.
So we know we have a lot of other, additional opportunity. We're open, obviously for additional suggestions. We have many projects that are in the queue right now, and we look forward to reporting to you and giving you an update again at one of our next meetings. If there's any other questions, we're very happy to take those.
Thank you.
Thank you, Kim. Let me just ask around to the committee members. Jose, any questions? Any comments?
No, just more than anything, just nice to see H&H at the forefront of innovation in the space of IT and nursing and taking care of our patients the best way we can. It just reflects well on our quality and thank you. That's it.
Thank you.
Thank you, Jose. Dr. Katz, any comments or questions?
No, thank you, sir.
Thank you. Scott?
No questions. It was a really great report and great progress.
Thank you, Scott. Kim and the team, Jeff, Sean, Dr. Bolton, thank you so much. I think this is an incredible effort that you are doing in looking everything from the connection to our patients to the connection to the machines to ensure that we have all the information. The very great attention to the details on how the technology is used and how people can actually make the best of it. So I just want to thank you, and I hope that in the future, one of the reports is in the area of how we are supporting the group that is reaching out to our patients once they have either the procedures or their visits at our facilities, in terms that they follow up with their medicines, follow up with their appointments. I know that pre-COVID, we were having a lot of discussions. And I know that when we visit Jose, Sally, Frida, and I visit some of the hospitals, we were very impressed on how the staff in the different hospitals were ensuring that the patients feel the connection even after they left the facilities, that their total care is being taken into consideration. And so I know that you have a lot of things and that you're working with COVID, but that's an area that I feel that is also very important because our job doesn't end when the patient leave our facilities. It's just a continuation of our services. So so hopefully we can have a little bit of more information on how that may be progressing in a future meeting.
Absolutely. And we actually just launched Care Transition, so we'll be happy to bring an update on that.
Okay, thank you. Any new business? Any old business? Coalicia, is there anything else that we should be looking at for this meeting?
We good to adjourn, Fenny.
Okay, thank you, everybody. With this, I adjourn the meeting. Thank you, everybody, for all your work. And
Thank you, everybody.
Thank you.
thank you. Bye-bye.
Have a a good day.